Good. So I wanted to introduce myself. I'm Dr. Michael Murphy. I moved to Hillsborough County from Tennessee about 2 years ago. I had been working as a psychiatric medical director for HCA, and I had spent a lot of time coming down to Tampa to oversee facilities within the West Florida division. And I kind of fell in love with the Tampa and Hillsborough County area and decided to move myself and my family down here a couple of years ago, and it's been really terrific. Since that time, I took a position as the executive medical director at River Oaks Treatment Center, which formerly was the Tampa Bay Academy on Boyette Road in Riverview. That facility has been closed for several years, and AAC, American Addiction Center out of Tennessee, purchased the facility and built some more buildings and renovated it. And created a state-of-the-art addiction treatment center that really serves patients from all over the country, but could be a very significant resource for Hillsborough County physicians and patients. So this is a quick overview of the facility. It's on a 26-acre campus on Boyette Road. We have gym facilities, we've got outdoor recreational facilities, walking trails, and we house up to 162 patients at a time. Usually we're somewhere between 110 and 120 on a typical day. And we do everything from detox, from alcohol, opiates, other substances. We do inpatient rehabilitation, we do residential treatment, and we even do PHP and IOP, which are considered outpatient levels of care for addiction. And we are planning to open up an outpatient clinic within the next year, also on the campus. We also are a teaching facility, and this is something that I brought to the program just this past year in collaboration with HCA and the University of South Florida. We applied for and were accepted to have one of the first addiction medicine fellowships at a freestanding facility in Florida. And these are our two fellows in the middle. And Dr. Abasina, who is the other faculty member who works with me and my associate medical director. So we're spending a lot of time now teaching these doctors about addiction medicine so that they can go forward and serve. Many of them each of them want to serve the communities in Florida, in Central Florida in particular. But we're really proud of this partnership, and it's the first time I think outside of USF and some of the traditional academic centers that we've had this kind of fellowship in the county. So River Oaks also has several specialty tracks. We focus on LGBTQ populations. We have a first responders track that is very popular. And then we also do a lot of work around people who have co-occurring mental illness, either pretty severe mental illness like bipolar and psychotic disorders, and then also people who have PTSD or depression. So we have an emotional recovery track for longer term serious and persistent mental illness, and then a trauma-informed care track, which recognizes the preponderance of trauma, life trauma, in patients who present with substance use problems and depression. And in the next year, we are planning to expand into the professionals resource network, the PRN program. I've been trained for a couple of years now as a PRN evaluator, but we are also now authorized through PRN to be a training and education site, but also a treatment site for physicians for the state of Florida. And we're going to expand that to include other professionals as well. So that was all I had for slides, but I just wanted to give you the information for how to refer patients to us. We are open 24 hours a day, 7 days a week to take clients, and we can take people right out of your office, right out of a hospital, right out of an emergency room, and a physician will assess them and figure out what level of care they need to be at, whether it's detox, residential rehab, or a PHP, IOP kind of outpatient level of care. So thank you. I appreciate your time.